Okay, psychosis is impaired perception of reality, evidenced by one or more of the following disturbances. Your patient can come in with hallucinations, also delusions, disorganized thinking, speech, or even behavior. Primary psychosis is resultant of a psychiatric disorder, that is like schizophrenia. Secondary psychosis is resulting primarily from a general medical condition or the effect of some substance abuse. An example of a general medical condition would be something like organic psychosis from a visible brain pathology. The first thing you do is acute management checklist for psychosis. Number 1, you rule out any life-threatening causes of acutely altered mental status. This can include so many things from hypoxia to hypercapnia, hypoglycemia, opioid overdose, carbon monoxide poisoning, cyanide poisoning, and hypothermia, shock, or sepsis, just to name a few. The next is to always treat the agitation. Make sure both the patient and the staff are very safe before you can facilitate any patient assessment whatsoever. Your acute management checklist goal should be finding out if the patient has primary or secondary psychosis. For primary psychosis, typically you want to use a recommended regimen of antipsychotics such as haloperidol, and you want to repeat this every 30 minutes to 4 hours as needed. You can also use risperidone. Sometimes you can also add a benzodiazepine like lorazepam as needed. You usually add the benzodiazepine if there's agitation that continues after you use an antipsychotic. If you do believe a patient is having a manic episode with psychotic features, you can consider using valproate with consultation of psychiatry. So what if someone has secondary psychosis? They have a distorted perception of reality, characterized by delusions or hallucinations or disorganized behavior. Whatever it may be, it could be a brain tumor or electrolyte abnormality or it's substance abuse. What would you do for the treatment? Well, let's say that we're dealing with delirium. You have an acute complex brain syndrome that's characterized by some waxing and waning of confusion along with disturbances of consciousness. Their cognitive function is also disturbed, and they even have psychomotor behavior such as hypoactivity or even hyperactivity. You find out that they don't have any focal deficits. You can start the recommended regimen of second generation antipsychotic. You can use risperidone or olanzapine, but you really want to avoid benzodiazepines in delirium unless the underlying cause is alcohol or benzodiazepine withdrawal. If the secondary psychosis is substance related, psychotic agitation because of CNS depressants like alcohol, you can use haloperidol, or if the psychotic agitation is due to stimulants or alcohol withdrawal, include benzodiazepines additionally to antipsychotics. Don't forget, if you think it's alcohol-induced psychotic disorder, benzodiazepines are the mainstay of pharmacotherapy for alcohol withdrawal syndrome.